If you haven't already done so, please watch the other video that actually discusses the mechanism of injury and the signs and symptoms and treatment and nursing care of spinal cord injury in a separate video. Yeah. So spinal shock occurs immediately after the injury. It can last anywhere from 24 hours up to 6 weeks. And it includes a complete but only temporary loss of certain functions that mostly include the musculoskeletal system. So motor and sensation as well as autonomic activity are usually lost below the level of the injury. And that is because the brain is unable to transmit any signals to the muscles and organs because we have that injury and there is no communication below the level of the injury from the brain. And so signs and symptoms include flaccid paralysis. There are absent deep tendon reflexes. There might be decreased visceral and somatic sensations that can also lead to anhidrosis, which means an absence of sweating, and then a paralytic ileus because the visceral organs are also affected, not only the muscles. So keep in mind it's internal as well as external. And the treatment for that includes, as with anybody with a spinal cord injury, spinal stabilization, supporting ABCs, and then PT and OT and rehab, and then other measures to support the bladder and bowel that I discussed in the other spinal cord injury video.